Hello, everybody. Thanks very much for joining us. For those of you who don't know me, my name is Peter Llewellyn. I run the services at MedComms where you'll find information services, activities, information resources, and so on, all freely available to the global MedComms community, by which I mean people who are working in and around medical communications, medical education, and medical publishing. So today I'm absolutely delighted. We've been joined by Ana and Jon and Jamie, and I'll let them introduce themselves in a moment. We're going to talk about a topic which I've enjoyed talking about much over the years, extending the reach of publications. We put a question mark in there, what's to discuss? I think there's quite a lot to discuss. We're going to start by me handing over to Jon, who we're going to have a presentation, and then we're going to open this up to a Q&A. So those of you in the audience, please remember, you've got a couple of text boxes, text in your questions and your observations and your comments. So without further ado, over to Jon, please. If you could just share your presentation mode, Jon. That's it, perfect.
Great, thank you very much, Peter. So yes, I think the first order of business was for us to introduce ourselves, and we agreed to go alphabetical. So Ana, would you mind introducing yourself first, please?
Yes, hi, I'm Ana Bozas. I am currently Associate Director of Global Medical Communications at Akcea Therapeutics, which is now Ionis Pharmaceuticals. I've been in the industry for now it's about 8-9 years, working for a couple of other pharmas before, a little bit of consulting, and I have a PhD in biochemistry, and I've done some bench work in my life. So mix, the usual mix.
And Jamie?
I give it on to Jon. Oh, Jamie, there you go.
Yeah.
Hi, everybody. Good morning, good afternoon, or wherever you are. It's morning here in New Jersey. My name is Jamie Weiss. I'm head of global publications at Pharma. I have a PhD in cellular and molecular neuroscience, signal transduction specialization. So I love signaling. And I've been working in the industry publication field for 8 years. Before that, I was a professor running a research lab in cellular and molecular physiology. So I came from academia, and I'm loving publications, and I love digital and innovative publications, tailored innovation. So I'm really excited to be here.
Thanks, Jamie. And I'm Jon Lynne-Davies. I've worked in the medical communications world for roughly the last 15 years. I'm based in Canada, just outside of Toronto. And about 3 years ago at an ISMAP meeting, I was approached by the founder of a company called TrendMD. And through those discussions, I've ended up working with medical affairs and publications teams at global pharmaceutical and biotech companies all over the world. So today we're going to be introducing that to you, as well as looking at other ways that you can extend the reach of publications. I think on behalf of all of us, we just wanted to add the standard disclaimer that these are our opinions as members of the panel, and they do not necessarily reflect the official positions of our employers. So to get that clear and out of the way. I think where we were sort of going next, Jamie, I think you were going to kind of walk us through, this is sort of the meat on the bones of the discussion today. So if you could help us understand this slide, that would be helpful.
Sure. I know it's a busy slide, so I'm just going to go over, what's going on in the world of publications. And as you know, especially with the COVID-19 pandemic, it was already digital before. It's gone even more digital, especially at the Congress level. So, I would like you to think of your publications. You have a scientific information digital hub. And, as I already mentioned, Congress presentations and anything highlighted in purple, I've done in the past positions, or I'm currently doing now. I know Ana has done newsletters. I haven't had the opportunity to do that yet, but there's all different ways we like to, increase the reach of our publication. So if it's Congress presentation, it could be slide kit downloads. It could be on the QR code. Congress presentations now with the pandemic are virtual. Plain language summaries, again, you can do that for Congress or manuscripts. There's different ways that we can, extend engagement drivers with videos, podcasts. And then if you look on the right side here, there's tailored bite-sized content for publications. Again, slide deck, you know, interactive data visualizations. I've done augmented reality. Sorry, that should be in purple. And then down here on the bottom right, it should traffic drivers. You know, you've spent all this time working on your, you know, your classical publications, and I'm sure a lot of you are already doing digital. How do you get people to them? So with posters, you know, in Congresses, it's usually QR codes, but today we're going to talk about how do you, can you traffic drive to manuscripts?
Thank you, Jamie. So this sort of begs the question and sets up an introduction for TrendMD quite nicely. I appreciate that. For those of you who are not aware of what TrendMD is, it is the reading recommendation section on over 5,000 medical and scientific journals. So it is its own sort of ecosystem, but it works within the publishers of top medical content, and this includes journals such as, I know we have a huge contingent here this morning from the UK. It includes the British Medical Journal, includes JAMA, includes lots of society journals from Europe and North America. Obviously, ASCO, ASH are huge ones, but we're also the American Psychiatric, American Diabetes, American Society of Nephrologists, European Respiratory Society, the American Thoracic Society. The list really goes on. And TrendMD is really quite ubiquitous out there within the medical publishing community. So with that as a bit of a backdrop, typically people are still sort of scratching their head a bit and sort of going, what do you mean? So I grabbed some screenshots from some publications. And on the left here, you can see this is something I believe I snipped this out of Journal of Clinical Oncology. And on the right-hand side, you can go to any Journal of Clinical Oncology article you like. On the right-hand side, you'll see a section called We Recommend. And if you scroll down on that, you'll eventually find the TrendMD logo. Here we are in the BMJ, and what headline do they use? They use other content recommended for you, and they'll have some lists of content there. And then finally, I've pulled one from JAMA as well, and their title is Others Also Liked. So the publishers themselves, they choose how much real estate they want to give us. They also decide what the headline is going to be, and ultimately they are the arbiters of what the links are to the content. However, the value proposition of TrendMD to healthcare professionals is it's going to be relevant reading recommendations. And this is a key point. The reading recommendations are based on what they're currently reading, what they've read in the recent past. And we also use something called collaborative filtering, which helps even further refine the reading recommendations. So it's built using artificial intelligence, machine learning to really understand what that healthcare professional is interested in. So that's sort of a top line understanding of what TrendMD is. And how we do these recommendations, it's probably very similar to what you've experienced on either Amazon, or I actually prefer the Netflix example. If you've watched a drama series on Netflix and you've watched it to completion, maybe it was 8 episodes, and someone else has watched those same 8 episodes, but they've also watched another drama series to completion, maybe it was 7 episodes, chances are Netflix is going to suggest that you are really going to enjoy that other drama series because someone else who had similar interests to you liked it. So in a much more sophisticated way, we're using that kind of technology to make reading recommendations to healthcare professionals. So in about as tight a way as possible, that's my easy explanation of what TrendMD is and does. I think we were going to then pass this back to Jamie and maybe some comments from Ana.
Sure. So one of the things I had generated this slide because I was trying to convince people that, you know, why I wanted to try TrendMD. And, you know, some of the reasons why is, you know, it looks a lot like, you know, what would pop up on our journal anyway. It drives user engagement, online traffic, you know, increase readership of your articles. And then for me, I've also looked into campaigns that you can do by the publisher, but they are a lot of email campaigns. And for me, I think for publications, at least for me, that was not the way to go because it seemed a little bit too direct of a promotion. I like the fact that you can target a specific audience. I've used it in the past and I had good experience working with key staff members, especially John. And I like the fact that you can get metrics. You could get monthly reports that let you know exactly, how many healthcare professionals clicked, were on which website where they saw everything. And then I also like the fact that this is just one of them, but there's a couple articles that actually, did a systematic approach and a little bit of a, experimentation to evidence-based to show that it actually does work. And then I'll hand it over to Ana.
So I basically am echoing what Jamie has said. I do like the idea that this is more of a passive mode for the paper that you're talking about to be seen. I do like the monthly metrics report. I'm trying to remember if we may have received the report actually more frequent than monthly because we were so excited and we'll be like, what happened? And we'll be like, this is what happened. And in fact, we've had quite a success with reaching the target audience. It was in some ways it was surprising because apparently in the US people are really excited. They read a lot, so we had success within 3 days instead of a month. Okay, so sometimes you actually realize in real life where you are with your audience. Who's reading it, which geographic region is more interested, and so on. So that was a surprising but interesting finding. And yes, I will say that for us it was an effective experience.
Very good. I should add, as far as our ability to find healthcare professionals on the system, we are able to narrow it down by country and by specialty and also by keyword. So for example, if you were going after neurologists as a group can break into several subspecialties. There may be migraine neurologists, there may be movement disorder neurologists, there may be MS neurologists, and we can add the keywords so that particular audience is going to see the recommendation as opposed to the other that's not interested. And the final sort of arbiter of have we found your audience or not comes from the fact that they actually have to click on it. Unless they click on your link, you don't get charged, and nothing has really happened until we've connected them with your content.
Yeah, and if I could add that, I think that they have to choose to click is most important for me in terms of, you're not shoved, it's there, it looks like suggested reading, but they don't have to click it, and that's their choice if they do click.
Yeah. I noticed we have a question from Sunil Joseph, and he's asking, who gets the monthly report? Can anyone request this? And that's for the clients. That's something that they get. And what actually happens is after 2 weeks, we give you a live link so that you can see how it's performing on a daily basis, if you like. You just have to click into the live link and you get a dashboard sort of showing you what's going on. And then once your program has completed, you get a full presentation, PowerPoint, PDF report that you can share internally. Okay. So I guess, to sort of conclude the slides then, Jamie, do you want to start with this one?
Sure. So, we already just went an overview about, digital enrichment and, the engage diverse information consumers and appeal to many learning styles. That's why we do digital, right? And so, if you just read a PDF, that's kind of flat. We know that there's evidence out there that these digital enrichments increase the presence of publications. I'll skip a third point because that's from another talk. And then what next one? But I would say, you're spending a lot of time and effort on your publication. Look for ways to share assets across function. And then again, the last point, which is the most relevant here, is that you're spending a lot of time in your publication. You probably have digital enrichments. get people to look at it, right? Even after the journal's assigned, especially if you're in, launch or you have really critical data, it's really important, I think, to have a traffic driver.
Okay, thank you.
I will add to that for me, it's the uncertainty of have the people seen the article or not, and this for me is peace of mind. So besides the traffic driver, it says yes, they have seen it. These are the guys who have seen it. This is where else you should make an effort. So depending on what the audience tells, what the report says about the audience. So yeah, it was very, very useful to me.
Oops, sorry.
Okay.
Sorry, I guess that is our contact details. I'll leave that up. Excuse me for a second. I got a frog in my throat. There, I'm back. So I'll leave that up just for a second, and I'll pass it back to you, Peter.
Great, thanks, John. Thank you very much. Thanks. Okay, so that was a bit of a scene setter, and as I say, I think there's lots to discuss here. So I'm slightly intrigued as to how many directions we can go in at the same time, sort of thing here. And can I start with just a little bit more, just to deal with the TrendMD? And I'm really quite keen to broaden this conversation out. But just help me understand a little bit, because I might just be being a bit stupid here. With TrendMD, you've talked about the metrics, you've talked about targeting content and so on, yeah. But if you say look on the bmj.com, I can go to bmj.com, I can find your further reading, I can click on that and go over to something else. You're not actually tracking that it's me, are you? Unless I'm missing the point, because it's all the freedom is there to move. So when you're talking about tailoring content, it must be more about the article that I'm looking at. And you're then saying, well, the sorts of people that look at this article would be interested in these sorts of articles, rather than, I know it's Peter Llewellyn and his reading histories. Can I just clarify that? Because I wasn't quite sure that I certainly wasn't clear when you were talking, John, about how that was done. Do you see what I'm saying?
Yeah, absolutely. And it's an important point, Peter. So thanks for asking that. So for the last 3 years, TrendMD has been sending emails and communicating with healthcare professionals worldwide to explain our value proposition. So millions have registered with us and want that engagement. There's nothing a healthcare professional has to do. Those reading recommendations are going to be there, but we're doing multiple things to help us understand who is online at any given time. As you can imagine, privacy legislation is different in different parts of the world. There's much more that we're able to do in the US market than we can in the rest of the world because of privacy legislation. But we do know through opt-in registrations and permission-based, we do know who millions of healthcare professionals are. From this, we can understand what specialists look like. We know how an oncologist behaves online compared to a neurologist, et cetera, et cetera. And our founder actually did his PhD on how physicians behave online. So there's a lot of deep understanding that's going on in the background to make sure our article recommendations are going to the audience that our clients intend to see those links.
Okay, so there's a mixture of things going on there. So Peter Llewellyn, and I can be doing this while I'm talking, I have done this while I'm talking to you. So I go to the BMJ, I click on the article recommendation, I go over to Cell or something, and I'm looking at cell research. So you don't know it's me.
No.
However, I could have signed up to TrendMD, and therefore you would have the opportunity, at least anyway, to know it's me, and therefore you have different levels of granularity of data. Is that right?
Yes and no. It's not something we do in the EU or the UK. That's not something that's of interest to us. We collect enough data to be able to provide the service that we say we're going to provide, which is relevant reading recommendations. The US, completely different story. We can get much more granular within the US, but for the audience that's here that's listening today, which is primarily a medical affairs publications audience, their interest is typically to reach a certain specialty with certain keywords attached to that in a geographic region, and that we can do worldwide.
Okay. So, all right, sorry I laboured that one slightly. That was just
That's
me
fine.
trying to understand. But it's worth making the point, apart from anything else, that I'm looking at something different to what you're looking at in the States, sort of thing. I mean, it's sort of self-evident, but maybe it's not entirely obvious to everybody. And so there's these different levels of engaging with people and so on. So I get all that. Okay, so that's great. Okay, let's just stick with it for the moment then. Sarah's just said, can you quantify the impact of TrendMD for a typical article? Have you got any data have you got any rules of thumb if you're asking if there's an article there, what are you suggesting that you could what sort of impact could you have on that article? % increase in readership, if she's asking.
Yeah, an absolute dream scenario, if you've never worked with TrendMD before, a perfect scenario is to use us with a small open access publisher that's going to be willing to share time on page metrics with you. And there are publishers out there that are happy to do that. This is going to show you not only did we direct the right traffic to your publication, you're also going to get the amount of time they spent on your publication, and that is the single biggest thing. When clients get that information, they go, wow, this is really powerful stuff. But if you're dealing with JAMA or the BMJ, quite honestly, they're not going to be willing to share that level of data with you. If you were sending it to an internal site, let's say you kept a PDF of a publication on your medical information site or some sort of medical affairs site, again, you would be able to capture those metrics. But typically, there are some journals, and I think JAMA is one of them, where they give you those really nice graphs that as soon as a publication publishes, you get all kinds of readership, and then it drops off over time. If a TrendMD program was to be implemented, once it had dropped off, you would see it climb back up again. So that is one way of measuring impact. Clients come with different feelings. Sometimes they want to have the TrendMD program to coincide with the launch of the paper. At other times, they wait a few weeks and then help make sure it reaches their intended audience. Another common use case is if you've published in a major journal. We have several programs where they've published in the New England Journal, and then there's a firewall on the New England Journal for, I think it's 6 months. And once that 6-month firewall lifts, a TrendMD program can get the full content of that article back out to your intended audience.
Okay, cool. So it's quite highly configurable.
Yeah,
I got that. I managed that word, didn't I? Well done, Peter. Okay, so Anna, it looks like you're going to answer Sarah's question. Would you want to add a comment from your point of view?
So from my point of view, again, we don't necessarily have your article would have had 10 clicks. It has 100 clicks now, but you kind of know, if you've been in the publishing field for a while, which articles, get the buzz and which don't. So, 90% or 99% of your publications won't be New England Journal or JAMA. So you kind of know how many clicks to expect. So, I would say, based on my experience, that for me, it was like a 10 times increase. So it was extremely helpful.
Okay.
And I will tell you, I like the concept generally. So when I first spoke to Jon about it, he told me like, this is what you see. And I'm like, that's just like Amazon. I like it. All of my shoe shopping is through Amazon. They show me other people had this kind of shoes. So it was definitely helpful. It wasn't hard metrics, but again, if you've been in the field for, you don't have to be forever, a few years, you basically get a feel for, what's the expected readership.
Okay.
Yeah.
Okay.
And
I mean, one of my
sorry, I can actually give you, if it's okay, if I can comment, I actually can give you numbers for an article we did last year. The article came out and we waited like a month, and I think there were like 60 clicks or views. And then after we did the TrendMD, I checked it much later, and it got up to over 4,000. So that's what our experience was. So it worked well for us.
Okay. And one of my bugbears with discussions around publications and social media citation impact and all is it's sort of the logic is there, it ought to work, but there's not been an awful lot of data to back up some of this stuff. Yeah. And I think we're now starting to see data and publications on about what's happening, but the logic is there, isn't it? And it's been frustrating that for me, some of the blindingly obvious stuff has not been implemented more quickly because people somehow want to know for sure. Anyway, so it's good to see we're doing that. I'd like to broaden the conversation out with, and let's go Anna first. I'm going to go with Anna first, and then Jamie. I've spent a lot of time in the past arguing with people. It feels like I've argued in the past with people that everyone's attention used to be, and maybe some still is, get the paper published, tick the box, move on to the next paper. And we used to have arguments about, well, that's only half the story. We've got to get out there and share the data. What's the point? Otherwise, what's the point? So am I oversimplifying? Am I being over cynical? Is it true, I would say, that relatively recently, things have changed and people are more interested in any techniques they can to get readership because publishing the paper is just the first step? Have you got a comment on that? Am I just talking rubbish there? Do you agree that that's actually important and that things are changing and that people are taking that more seriously? And just out of interest, do you think there's a reason for that? So Anna, I'm going to start with you. Just talk generally around that point.
So I will say, publishing has been around for a while, essentially since the Gutenberg press, okay? In some ways, things are still like that. You still get the galley proof. Nobody's typesetting stuff anymore. It's all digital. And still, you have those timelines and that process and, like the mysterious, what are people doing with the printing press behind the scenes type of stuff. In others, publishing has changed quite a lot. I mean, if you look at, how the explosion of essentially of print materials, and by print, I mean online, because really that's the print for us these days. It's, it's exponential. It's really exponential. I was looking at, I think the last time I saw a graph was in 2010. So I'm telling you, I'm like way behind, and then it was exponential. I don't even want to look at now because I'm going to get like vertigo, okay, basically. But the things haven't dropped off. Things are picking up. There's more, internet is like a huge platform. So people can't wait to get their story out there, and more people want to get their story out there. And there's more people who want everybody else's story out there. So we are producing content at rates that frankly, I don't think any human being can consume at this point, hence the AI rise and so on, which is a whole new conversation. And from the perspective of those of us who are producing content, we feel like our share of the voice is smaller and smaller because you're one person, and you get this avalanche of hey me, how about me, So it's the pressure to get your content out there. I mean, from the perspective of a publication professional, what you want is to have your science heard, okay? Now, not everybody has sexy science, and by sexy science is a person put in implant and now they can communicate with space aliens or whatever, Certainly you'd get the headlines on that one, okay? But the rest of us is more like, well, my drug still works, or my drug is still safe, or whatever it is your message. So you want that science to be heard by the right people who care. You don't want it to go into the space somewhere and be forgotten, a tree fallen in the forest, do you still hear it type of stuff. So there's this tremendous pressure to do more than just put it out there. It's not even just have it in a magazine or in whatever was the local society's journal. Do people even read print versions anymore? I mean, I had, either bosses, CMOs, whatever, who would get their society journal and they would read it faithfully every month. But I think this is a dying kind of expectation. I think people now are grabbing content on the go in between, things that they're doing via any method that catches their eye. And, especially with the pandemic, frankly, I found my personal attention span, if it was 8 seconds before, now it's probably 1 second. Okay. So it's, like the real estate of somebody's mind is, harder and harder to get, So we are using as much as we can to grab attention. We're not salespeople. At least I don't think we are salespeople. But we want to at least, hey, there's science. Have you read about this? That's essentially the point of what we do. So any other method that can bring up to the attention of, especially the target audience. So again, about your science, I consider it fair game and something that we have to adopt. has this really been the way in the industry in general where I'm working? I'm not sure. There's a mix of colleagues that I'm working with, and some of them are like paper or bust. Others are forget about the paper. Where are all the bells? Forget about the paper. It doesn't even matter if it's there. If you didn't spread the word about it, might as well not exist. So I think that the perspectives are changing, and we are forced to change because, like I said, of the avalanche of information. I don't think we're there yet.
Okay. And Jamie, can you pick up on that? And what I'm sort of interested in is within an organization like yours, how much pressure is, if you like, being applied now to you to prove that your papers are actually reaching the audience, and how much pressure do you then put on the publishers or the agencies that work with you and so on? And is that real? Do you see what I'm saying?
Yeah, I see what you're saying. Actually, I haven't had that sort of pressure per se. I mean, I think in companies in general, there is talk about KPIs, right? But anything that we can do to show value and show impact is beneficial at any company level. But one thing I can add to what Ana has said, I echo everything she said, but now that everything's online and content endures, we have an opportunity, right, to extend that reach, and it could be at any time. You could use TrendMD, I would say, or something like TrendMD. And the other thing I would also add is, I know that this is targeted to physicians, but one thing that has happened during the pandemic, and I think I've noticed it, is laypersons are also looking at content. They're looking at it, and I think there's an increased sense of peer-reviewed publications in general, especially with these servers coming out. There's a big, controversy. Should papers be out if they're not peer-reviewed? So I think, anything where you can increase the reach of your publications is a good thing, and I think people are interested in that, no matter whether you're in a company or not. But for me, I haven't had that sort of like extreme pressure, like somebody saying to me, you got to have a traffic driver. I think companies are just starting to realize that these exist, these traffic drivers. But one thing I can say is, if you're launching, you don't want to be accused of pre-approval promotion. And I think, some of these other ways of doing it might fall into that category. So you have to be careful.
Yeah.
Okay. Go on, Jon, go on.
Yeah, I guess the only thing I would want to add to that, just because I have a wider perspective talking to a number of, big pharma, small pharma, on a routine basis, is this decision-making isn't within the realm of publications alone. It is a sort of a broader medical affairs. When is scientific exchange appropriate, and all of the governance that goes around that kind of decision. And that's sort of what I'm working with pharma companies on a daily basis, is really helping them come to their own conclusions about that, so that as Jamie said, this is not seen as a promotional thing, as opposed to doing it for all the right reasons to get your basic information out there to the intended audience.
Okay. You picked up on, Jamie, you mentioned preprints and so on. ISMAP, Emwer last week published their sort of their sort of open statement. Again, how concerned are you from within a pharma company? How concerned are you about the sort of maybe the preprint side of things? Publishing the data before peer review and encouraging the discussion and so on. Is it something you have to just stay away from, or how do you manage that situation? Because I guess, especially these days, the authors are quite keen to get some of this data out there, and they're finding these ways of doing it. So again, just a little bit, Ana, well, Jamie, I'll ask you first and come back to Ana, because you raised it. How are you seeing that? I saw. Did you want to answer that one?
I haven't encountered that at the industry level, but I have my own personal opinion. It might be controversial. I don't like things to be out before they're peer reviewed, because I've seen things like the New York Times pick it up and put in their title. And I actually wrote to New York Times when they first did it, and I said, you haven't let the audience know that this has not been peer reviewed. And I don't know if it was my comment, but then they started doing it. And so they will put like something in the intro that this has not been peer reviewed or something like that. But I don't know if everybody sees that. So in my opinion, I would prefer, I know people want things out quickly, but it depends on the audience. Like some scientists, I think, can understand that it's a server and not been peer reviewed, but I don't know if the general public understands that. And for me, it can spread information. That's just my personal opinion. So
yeah, no, I have to say, Anna, have you got a comment on that one?
I
Do you
absolutely
control
have
that
comments
process
on
at all? Go on, go.
I will. So we all have our feelings on the matter, and I'm going to underline these are feelings. They don't, say anything about the company, etc. All the disclosure statements. Anyway, so I have mixed feelings about it. This preprint conversation has been going on for at least 5 years that I know of, probably more like 10, probably no longer than that, but certainly for quite a while. And certainly the proponents are making it sound like all the science is out there. You would be left behind if you don't do preprints. If you look at what's being preprinted out there, a lot of it is basic science. It's essentially the academic science. There's nothing wrong with it. I just think that the risk bar is lower. Okay, you're not affecting patients, hopefully. Okay, and unless you're talking about some random people who have issues, but you're not affecting patients. You're not affecting commercial process. There's a whole. It's a different ball game essentially. For pharma to use preprints is a little more difficult. Again, we have regulatory issues. Things could sound like we're putting misinformation out there. I will say, 4 or 5 years ago when I looked at this issue, there was nothing. There was nothing on phase 1 onwards as a preprinting. It was all basic science, toxicology at most if you wanted to go somewhere, but there was no clinical data. Recently, I have seen maybe more like post-marketing studies as a preprint. And on that thing, I'm a little torn. And the reason for that is some of these studies that are on preprint servers actually deserve the attention. They are well done studies. They should be seen by the audience. And at least the stuff that I've seen, obviously I'm not talking about everything. And certainly I want to exclude the COVID part on preprint servers because those had issues. And I was upset about it. And I'm like, they need peer review. But let's talk about in general, if you're not actually, again, if it's not a hot issue and time is not of the essence or whatever, and you have your time to, properly write the paper and put it on a preprint, I'm not necessarily opposed. And the reason I say this is because I came a couple of issues with publications that weren't necessarily, how do you say that? They weren't necessarily planned well in advance. There were projects that were executed, they were perfectly fine. They got, whatever they needed as a scientific message. They were ready to disseminate, and we couldn't publish them because the procedure for establishing the project wasn't, per standard. So, for example, they didn't have an IRB waiver, or they didn't have a standard analysis plan, or whatever. Okay. That didn't invalidate the science, didn't invalidate the results, but it was enough for a journal to say, no, we can't publish this. And then all of that work essentially go down the toilet. That's not fair either, okay? I see why a journal wants it because they want to be sure of the science. On the other hand, the people who did the research, you can go back in time 5 years, okay? Hey, wait a second, we forgot to ask for whatever, and I'm torn about it. I'm torn about whether or not it deserves to be on a preprint server. A lot of the publications that are on a preprint server don't get published elsewhere. So it is some way of being out there in the wild. I don't know. It's still a gray area. That's the take-home message, okay?
Yeah, but it's complicated, isn't it? And it's getting the balance right. And it's, we're all happy to see the right sort of information move forward through the system quickly. But a lot of us are concerned that some of the wrong sort of information is moving through the system quickly. And as you said, a newspaper picks it up and runs with it too quick. So there are problems.
And then the server, I'll tell you, also looks very much like a perfect journal. So if you're a lay audience and you look at it, you're like, it looks just like JAMA. I mean, so they have no idea that this is actually not vetted and it's essentially somebody's opinion. Okay, could be a very good opinion, but
Just help me understand from both Anna and Jamie. Have you got a company policy on preprints?
We do not have an official policy.
Okay, I just wanted a simple one. Okay, and just to open it up again broadly, Anna, I'll come back to you in the first place, but open access publishing, would seem to me logical blindingly obviously a good way of getting more people to see your information and so on. Where do you personally and where does your company stand on open access publishing? Can I just ask a simple, blunt question like that?
Okay, so for me personally, I'm all for open access. The science needs to be seen and heard. In some cases, open access is an issue because of cost. So you have to pay for people to have open access. And a lot of the academic institutions have essentially said, we don't want to do any kind of research if we're asked to pay a lot of money. It has to be automatically open access, and ideally we shouldn't be charged. And I see why, because they're already, for them the service of providing the science is enough. That service to society. For the industry, since we can afford it, it's a no-brainer. Do open access. You get more. I mean, there are plenty of studies to say that you're cited more, your science is more enduring, and people in disadvantaged countries can access the science, and they're not behind a paywall. A lot of journals, and I'm sure that I've seen some people from the journal side in the audience, are offering this tiered approach for people who want to do open access. So if you're in a country that is considered economically disadvantaged, they'll offer it to you for free or for a very, very discounted rate. So it's not all, the evil publisher. They're working with the people too. So all in all, I'm absolutely for it. Some of the time is, can you afford it? Okay, but obviously we can afford it. So go for it.
Okay. And Jamie, have you a view on that? Again, is there any sort of policy at your end in terms of encouraging or not open access publishing?
Yeah, we always encourage it where we can, and echo what Anna says. It's the cost, and certain journals, the cost is higher. But for key data, yes, we have a policy that we always try to budget for open access. Definitely.
Okay.
Peter,
okay.
can I add a quick comment
Jon,
to that?
Please.
Yeah. When authors are asked what journal do we want to submit to, and obviously it's the author's decision what they're going to use, they're often rooted in their history, their society, and they want to go to their society journal, which is often not open access. One of the advantages TrendMD has, the reason they want to go to their journal is it reaches their audience, which they're writing for. So with something like TrendMD, there is the option to go to an open access and still have that audience have every likelihood of seeing the final publication. So it can help in that discussion when you're a true believer and want to use open access whenever possible.
Okay. No, that makes a lot of sense. We're going to be we are into the dying minute or two. This time does go far too fast for me. I just wanted to finish with again, can I just get a couple of comments from all of you? But I'm interested, Anna and Jamie, frankly, from within a farm company like yours. We've touched on the sort of enhancements, digital enhancements, extender type technologies, and you've touched on a number in your slide, Jamie. I think there are podcasts and newsletters and so on. Just give me a flavor of the sorts of things you're doing and the sort of directions we're going in terms of enhancing a basic publication to encourage readership. Can I just let you run with that for a minute or two each? Anna first.
So we have definitely, again, we have done the infographic thing, we have done the video thing. We haven't done much of many of other things, and I'm not really certain. COVID has changed a lot of things. I'm not certain where we're going with this. When you're doing pre-COVID, we had to do this stuff to get people's attention as here's more glittery stuff. Look this way kind of thing, okay? Now everything is online. Everybody's getting Zoom fatigue. I'm not even sure if this stuff is working. That's not to say we shouldn't be doing it. God forbid. I'm saying let's keep doing it. But I'm not sure that we have a online only way of catching attention, essentially. So we are doing it. It's an extra cost, and there's also an extra approval time because you have to go through our internal review committee stuff. So it's it gets us extra time and attention, but it costs us time to publish. So it's you have to decide which papers really deserve the royal treatment. Okay. Right. But we are doing it to a small measure. I would say something around 5 to 10% of the time. Okay, low.
Okay, but that's an interesting point to make. Jamie, would you just give a view from where you're sitting on that sort of point?
Well, in terms of what I'm doing now, we've just had a major publication come out, and we've done author videos. We've done, plain language summaries on them, which I think is really important, not only from a lay audience perspective, but if, payer perspective, for example, anything that can really help the content be understood is important. Previously, I've done things, a lot of things. We're starting to initiate QR codes at our company. It's a smaller company. Previous company that had QR codes, we did everything from podcasts to videos on the QR codes, plain language summaries. We did augmented reality, which was really actually very, very successful. Anything I would say where you can engage all learning styles, like anything with a smart device that people can play around with, touch, kinesthetic learners, visual, auditory learners, you can have music, speaking, whatever. People love it. So that's been my experience. And we hook it to Google Analytics and we get metrics to show that it's working. And if we've had things that weren't working, we kind of don't do them anymore.
Okay. But at the moment, is it a fair summary to say both of you are saying we're interested in any of these techniques, we're playing with lots of them, we're a little bit unsure as to how they work or don't work, and we are being a little bit choosy about, we'll throw the, I can't remember the expression you used, Anna, we'll throw the army or whatever the expression was at the 5-10% of papers that really need it? Or are you, or Jamie, it looks like you're going to say you're much broader than that, you'll do it for all of them. Just
I'm being much more, I'm not throwing the whole kitchen sink and an army at it. I'm being very specific because it's expensive. I'm relying on metrics, and what the metrics tell me is working. If that's working, I will continue to use that. Like augmented reality, I did things where I did an interactive quiz. It didn't work so well, but then we saw that the animations, which were in the answers to the quiz, people like. So we dropped the quiz and started doing animations. So, I'm only, I don't think that's the best. I think you have to think about your audience and what is going to be most engaging to them. And I actually think a tailored approach is best.
Okay. And learning as you go and tailoring it more on the basis of the metrics. Okay, look, we ought to have stopped now. John, have you got a final couple of words? And from a broader sort of industry point of view, have you got a couple of words just to add on that sort of a point? I'm just quite interested in what people are doing in terms of opening up access to publications generally.
Other than our technology, it's funny, I was actually just trying to respond to a question again from Sunil, where he's asked if our company has a relationship with a company called Kudos. I've never heard of Kudos. So potentially, this is a growing area of helping publications extend their reach. I'm not familiar with that particular one, so that's your answer, Sunil. But I'll leave it at that.
Okay. Look, we have run over time, so let's wrap up now the recorded part of this session. So everybody in the audience, we've still got a few minutes, and there's still a couple of questions we can pick off individually. But for the purpose of the recording, I'd like to say a huge thanks to the panel for joining us today. I know it's early over there, so thank you very much for coming and joining us today, and to the audience for joining in. All being well, the video will be up on NetworkPharma TV later on. If anyone's interested in what's going on here, if this is your first experience, go to medcommsnetworking.com. You'll find we're doing lots and lots of activities for everyone across the globe. And if you go specific to NetworkPharma TV, there's 300 plus videos now, so there's lots of great content there. Panelists, thank you very much. As I say, a huge thank you, because I know it's early in the morning, but I know you're also happy for me to say that people are welcome to contact you directly. The easy ways via LinkedIn. And I hope people in the audience and viewing the video later on will take advantage of that. There's lots and lots of things we could talk about here, but I think you covered quite a few points there quite well, and hopefully made people think a little bit about what's going on. And I do think it's really, really important to go beyond just publishing a paper. We've got to get the paper read and the information out there and understand more about how that gets done, and what works and what doesn't, and learn, like you're saying, Jamie, and do the stuff that works. Right, I'm going to wrap this up now. I'd like to say a big thank you to the audience, but also to the panelists. As I say, thank you for joining us, and I'm just going to close the recording. So can we just do what we always do and give a little wave, guys, and say good luck and good day to everybody. Thanks very much. Bye.
Good luck and good day.